On the health front, the country has marked yet another milestone in COVID-19, although it is likely one that is not desired. With cases rising steadily in the triple digits daily, so too are hospitalizations. Cleopatra Murphy has the details.
COVID-19 hospitalizations have hit a new peak, with 148 patients now being treated based on the latest health dashboard. That number is up from the previous peak of 125 in September 2021, when the Delta variant raged. Health officials are attributing this latest spike that pushes the active case count to 7,265 to the Omicron variant.
Omicron is putting a serious strain on our healthcare systems, not only the hospitals, even at our clinics. This is a challenge, and this is a challenge every country is facing, to keep healthcare services up and going, while at the same time providing essential services for those who have other medical conditions. We're working the best we can.
Based on trends, Minister of Health and Wellness, the Honourable Dr. Michael Darville, says most patients are hospitalized with other conditions and just happen to have COVID-19.
As far as the cases of COVID is concerned, we realize that those who are in hospital, they have to be moderately ill. And because they're moderately ill, we must be able to provide the care to ensure that they're able to recuperate and go from moderately ill to be able to be discharged from hospital.
With more patients in hospital, coupled with the challenge of healthcare workers being taken out of the system due to infections or exposure, Darville says the recent hire of 50 Cuban nurses is expected to help provide that needed care.
There's an orientation process, and that process should be completed this week. And once that's done, they would be deployed at the various institutions.
But Darville accepts that still will not be enough, and that's exactly why his ministry must be focused on building capacity within the healthcare system.
We brought in 50. There's another 40 students from the University of the Bahamas who just finished the exams. Hopefully we'll get them in the system as well. And then we will do a reassessment of where we are. And once that assessment is done, we will make steps to actually begin to fill those places. It's absolutely necessary to ensure that the healthcare services is improved upon, particularly with manpower resources.
Plans are still underway to use the University of the Bahamas' Grosvenor Close campus as an additional space for patients. Darville says that contract has been signed.
The South Beach Clinic was used to house moderately ill individuals who had COVID-19. That particular clinic has been put back into general practice, which was absolutely necessary. And the nursing school at Grosvenor's Court will be a substitute initially in phase 1 for that facility, and then it will be a ramped up facility to prepare us for what may come or what will remain.
Cleopatra Murphy, ZNS Network News.